for a bedside helping tool during our clinical activity. So, taking in mind all these considerations, thanks to Nestlé Health Science Italy for a non-conditional grant, we were able to let 9 of the intensivists of Italy deemed to be expert on metabolic support and nutrition to meet together to try to develop, to do their best efforts to develop a very practical tool, a very practical flow chart helping clinicians to do their best efforts for an effective metabolic and nutrition support. This is the final draft that we released by September 2023, and just to let you know what was our aim, what was the way we tried to develop this flow chart, we started from the framing. You have to assess your patient, you have to understand your patient in how stressed he is, you have to understand to predict amounts and needs. You have to start the conduction of what you prescribed. So if you prescribe a sort of amount of calories and proteins, maybe you choose an effective formula, you have to conduct and to monitor, because while you are monitoring, maybe you need day by day or week after week for the long stay ones, you need periodic adjustments, and after that you have to consider weaning and suspension just to restart and recover to oral spontaneous nutrition. And it's important because we are trying to talk about intensive care, but the patient is one, and the patient throughout its acute illness go in a sort of journey during the hospital stay. So we have to report and to tell the other physician that will start to take care of our patient. We have to let them know the treatments and what's ongoing on our patient.
This is our production, this is our flow chart, and this is the important things that we all together underline to treat the patient from the nutritional point of view. And our key messages is that is an up-to-date tool, that is a flow chart based on clinical and personal experience, and it was created by peer-to-peer comparison, and most important thing is that our flow chart is transferable and easy to use by the Italian, but also by the European intensive care community.
So thanks again to all of our colleagues from the advisory board. Actually, we talk on behalf of them, and thanks to Nestlé Health Science Italy for the non-conditional grant and support for this work.
Okay, thank you.